Hi, I'm Dr. Beth Kassanoff-Piper, President of the Dallas County Medical Society. I'm getting a lot of questions from patients about the new COVID variants. What are these variants? Viruses change frequently through mutations, some more rapidly than others, and some of these variants just go away while others tend to stick around and sometimes even become more prevalent than the original strain. Right now, the B117 variant is the one that you're hearing the most about. It's highly prevalent in England, but has also been seen in the United States, including Dallas. And there are other variants in South Africa and Brazil, too. The B117 variant spreads more easily and quickly than the other variants do, but doesn't appear to cause more severe illness or increased risk of death. It appears to be about 50% more transmissible or contagious. That means it could take less virus and less time in the same room with an infected person for someone to become ill. The CDC predicts that this variant will likely be the predominant strain circulating in the United States by March. So, are these variants making people sicker? Thankfully, none of these variants seem to be making people sicker than the original. But the increased number of cases because of the increased transmissibility will put more strain on healthcare resources and lead to more hospitalizations and potentially more deaths. How about vaccines? Will vaccines work against the new variants? Scientists are testing vaccines against the variants, and results should be available in the coming weeks. Since vaccines generate an immune response that recognizes different parts of the virus, changes caused by one mutation likely won't keep the vaccines from working. And even if the mutations decrease the effectiveness of the vaccine somewhat, scientists are hopeful that the vaccine will still protect people from more severe illness. So, what about if you had COVID before? Can you get reinfected with one of these variants? We don't know how long the natural immunity from having a case of COVID-19 lasts, and it's possible that the new variants will have enough mutations that your body's own natural immunity won't recognize them, and you could get COVID again. So even if you've had COVID, continue to use the precautions that we know to be effective against infection. People ask, well, if I get sick, how will I know if I have the new variant? The standard PCR tests used to diagnose COVID can't distinguish which strain you have. The only way to know for sure is to have special gene sequencing technology performed, but that's only done at some public health and university laboratories and isn't something available to the general public. The good news is, since the new variants are treated the same way as the original strain, and the same precautions we've been using protect against spreading it, you don't have to know which it is. And what can we do to keep from getting one of these variants? Just be extremely cautious about your activities. Lots of people have gotten a little bit lax in terms of following the guidelines. More people are getting together in small groups in their homes, going out to bars or eating inside at restaurants. People are making multiple trips per week to the store or lingering longer in the stores than they should. With these variants being more transmissible, you could get infected with less of an exposure than with the original strain. So now's the time to remind yourself of all the practices that we know work against COVID. Wear your mask consistently. Avoid groups of people. Avoid gathering indoors. And wash your hands frequently. And get a vaccine when you can. Thank you.